Hello. Thank you for coming to World Voice Day 2021. Your voice is essential. My name is Lauren Fay, and I am one of the speech pathologists here at the Duke Voice Care Center.
Hi, everyone. I'm Lita Scares. I'm Director of Performing Voice Programs and Development at Duke Voice Care Center and Director of Community Engagement for the Department of Head and Neck Surgery and Communication Sciences. Welcome. Very excited to have you all here for our first virtual World Voice Day celebration. And I just want to give a huge shout out to Lauren, whom you just met, who really has made this event happen. So huge thanks to Lauren and our colleague, Tara Nixon, who's working in the background, who are co-directors of World Voice Day, and the entire World Voice Day Planning Committee. That's Audrey Wallstrom, who you will meet shortly, Annika Wilson, Megan Esper, Caroline Banka, and our student intern, Olivia Boddiger. Thank you for this terrific event, all of you. So World Voice Day started in 1999 as Brazil Voice Day. And some folks in Brazil got together and they wanted to create an event that would bring together people from different disciplines that intersect at voice. So they were bringing together physicians, speech pathologists, singing teachers, singers, and the idea was just to increase public awareness of the importance of the voice and provide information on vocal health. In 2002, the American Academy of Otolaryngology and Head and Neck Surgery officially recognized this celebration, and ever since then, it has been known as World Voice Day, which is formally celebrated on April 16th. Duke Voice Care Center was established as a center of excellence within the then Division of Otolaryngology, Head and Neck Surgery here at Duke in 2006, and we had our very first World Voice Day celebration in 2007. In 2010, we created the Patrick D. Keenan Award for Vocal Health and Wellness to honor Dr. Patrick D. Keenan, who was a laryngologist and singer who worked at Duke for many years. And this award is presented annually at World Voice Day to people and organizations whose lives and work increase awareness of the importance of the voice. We have had to suspend the award this year due to the pandemic, but stay tuned, it'll be back next year.
My name is Catherine Strickler, and I am a middle school choral director.
My name is Jim Morrow from Chapel Hill, North Carolina. I'm a software salesman in the banking and payments industry.
My name is Elizabeth Hartley, and I am a patient at Duke Voice Care Center. I'm an elementary school music teacher.
My name is Michaela Bostic. I'm currently a senior at the University of North Carolina in Greensboro, pursuing a Bachelor of Arts in Music and Communication Studies.
I use my voice to communicate with friends, family, coworkers, but also as an educational tool to model appropriate singing for students.
My voice keeps me connected to my family, of course. I need it so I can say yes to all their requests. I also use it heavily in my job. I frequently make presentations. My territory is global, so it's even more important that I speak clearly.
My voice keeps me connected to my family, my friends, my loved ones, and my faith as a Christian.
My voice keeps me connected to my students. They are awesome. It also keeps me connected to my parents. I call my dad every day. Being able to do that in a way that is healthy and safe for my voice is super important to me.
I started having problems with my voice when I was treated for a pair of duodenal stomach ulcers. One of my vocal cords was damaged, causing paralysis in that one cord. I had very little pain. The primary symptom was loss of voice. I could only get a hoarse whisper to start.
I found that I was losing my voice a lot. I would get sick and just kind of never get better vocally.
I decided to have my voice evaluated at Duke Voice Care Center because By this point, I would start off at the beginning of a week with a full voice, and by the end of it, would have little to no voice.
At the time I sought help from Duke, I was struggling with the inability to simply get through a choral rehearsal without exhaustion. My voice had become such a strong part of my identity that this affected my sense of self.
But we evaluated my schedule and just found ways to cut out the use of my voice on a consistent basis so that I could rest.
It was so lovely to have a team of people who were saying, this is not your fault. You are doing everything correct. You are going to be able to sing again. We can help you. We decided that a surgical option would be a good step for me. So I went in for surgery, worked really hard on the recovery process, and have had really great luck.
I came to Duke Voice Care Center, and they recommended several weeks of voice therapy and simply strategies to help lessen the vocal load when possible.
In the weeks after the ulcer treatment, my voice had been improving somewhat, but was still very gravelly and continued to be low volume. I came to the Duke Voice Care Center. I met Dr. Seth Cohen. I elected to undergo an outpatient procedure known as a bilateral vocal fold injection. This gave a strong boost to my vocal quality, but it was still not as good as before the paralysis. After giving the treatment a few months to work, we decided to supplement it with a series of therapy sessions.
My voice problem helped me to realize that my voice was essential. It became very hard to participate in my daily responsibilities and as someone who just uses their voice pretty much 24/7.
I felt so limited, and that's a really challenging thing. I think my voice problem really helped me recognize how lucky I am to be able to speak clearly and efficiently in my day-to-day life.
My voice problem helped me realize that my voice was essential. My family, friends, and colleagues were very supportive. As a salesman in a highly competitive business environment, that was a different story. I felt that my rough-sounding voice could be an annoyance to my audience. There would be no sales resulting from sympathy for how my voice sounded.
This experience helped me realize that sometimes one person can't do it all. I'm thankful to have learned exercises to continue to build and sustain a necessary amount of vocal stamina and flexibility. I can continue to maintain my vocal health and strengthen my technique, but because of the vocal load I carry in my job, I may have to make strategic choices about how and when I use my voice. For better or worse, my voice has become part of my identity.
I want to make sure that I say thank you to our patients who were so willing to share their stories with us. Now we're going to hear from our colleague, Caroline Banka, who is not able to join us live tonight, but pre-recorded some information for y'all about why your voice is essential, why we should care about our voices.
Hi, I'm Caroline Banka. I'm one of the voice therapists with the Duke Voice Care Center. I'm delighted to be with all of you all today virtually to talk about why the voice is essential. Your voice is essential for so many reasons. The voice is essential for teaching, for self-expression, for celebrating, for singing, for warning, for calling for help, earning a living, comforting, for acting. It's part of our identity. We use it in sales. We use it to connect to those around us. Voice is especially essential for singers. Over the years, many of our patients who have been singers have shared how they feel about singing. Singing is how I express my feelings. Singing is my gift. Singing is how I worship. Singing is who I am. Without being able to sing, I don't know who I am. Singing with others is magic. Not being able to sing is devastating. Voice is essential for work. Voice is essential for essential workers, absolutely, who depend on our voices to earn a living. For example, some of our essential workers include teachers, call center agents, healthcare providers, first responders, retail workers, clergy. All of us depend on our voice to earn a livelihood. For essential workers during the pandemic, the demands on their voices have become even greater. Wearing masks makes voice use even more challenging for those like teachers who are already making heavy demands on their voices. Voice problems have increased during the pandemic, making it even more difficult for many of those essential workers to do their jobs. So it's really the perfect storm for many essential workers. Even if we might not consider ourselves essential workers, the voice is essential for all of us because the voice is what connects us to others. And we know that social connection is vital to health and even to longevity. Not only does the pandemic lead to isolation, as we all know, voice problems also can lead to social isolation. And here's how that works. If you're having a problem with your voice, sometimes it hurts to talk, it takes too much effort to talk. Sometimes other people speak for us, which is very frustrating. We avoid social settings because people can't hear us and our voices get exhausted trying to talk in noisy places. We avoid talking on the phone, and that's how everybody communicates right now, on the phone and Zoom. Because of our voice problem, because our voice might sound hoarse or weak, sometimes we see ourselves as weak, and sometimes other people also see us as weak, even incapable, even irrelevant. We become kind of invisible. So, voice problems can lead to isolation. The pandemic can lead to isolation. It's a double whammy. And both of those things, voice problems and the pandemic, can lead to social isolation and depression. I think the physical isolation that we've all experienced in the pandemic has made us acutely aware of what it feels like to be isolated and maybe even depressed. So the only silver lining I can see there is that maybe that helps us empathize a little more with the isolation experienced by those with voice disorders and the isolation experienced by others in normal times. So, in terms of our voices, maybe we appreciate our voices more and what they mean to us. So, that kind of loneliness and social isolation, they do have serious negative health consequences. And this is recognized by all the leading health organizations, including the World Health Organization. We know, for example, that social isolation can be as damaging to health as smoking 15 cigarettes a day. Social isolation has been associated with a 50% increased risk of dementia. Poor social relationships have been associated with a 29% increased risk of heart disease. So, the role of the voice in combating social isolation is meaningful. So, both voice problems and the pandemic can make us feel isolated, and together can be very concerning in the toll that it takes on our emotional and physical health. So, we're so glad that you're here today to learn more about how we can keep the voice strong and stay connected even during the pandemic. Thanks for your time.
Thanks to Caroline for providing her insight on how our voices really matter to us. So during this time of 2020 leading into 2021, we have been very familiar with the phrase socially distanced, but even though we're socially distanced, it doesn't necessarily mean that we have to be vocally distanced. So I have a question for y'all. I want to know how your voice use has actually changed during the pandemic. You're going to see a poll pop up on your screen, and I would love it if you would answer the question, how has your communication been affected by the COVID-19 pandemic? And over the past year, how have you connected with family and friends most often? I also am curious if you've experienced any of the following voice or throat problems in the past year. So let's see what happened. So 84% of y'all found that you've had to talk to others through a face mask and or face shield. Vast majority is seeing friends and family less often. More social phone or video calls, definitely more phone or video calls at work. A few people said singing more. Many people said singing less. Few people are talking more. Many people are talking less. About 21% have said higher voice demands, and about 34%, so more, have said lower voice demands. So in general, there's a picture of a change in how you're using your voice. A lot of people are connecting with friends and family over phone and video. Those are pretty close. And in person is much lower in comparison. And in this same space of time, many people have noted increased voice fatigue, increased hoarseness, or a change in how their voices sound, maybe more throat clearing, feeling like the throat is dry, maybe a cough. But hey, 13% of people have found that their throat feelings and their voice have actually improved in the past year. Pretty cool. Thank you for answering those questions. That gives us a good sense of how we're all in this together, and there are changes even just within this group tonight. As this poll results show, in the past year, we have had social distancing, isolation, staying at home. Everything has been different, but our voices are actually what have brought us together. In some ways, voice use has decreased. We're not talking to coworkers as much. We're not seeing friends or family as much, at least not in person. But in other ways, our voice demands have either changed by talking over phone or video, or the environment has changed, or they've possibly increased due to things like working from home or having kids doing virtual school at home. Along with these changes in how we have to use our voices, there have been undeniable mental health changes during the pandemic as well. Only about 6% of people felt that their mental health improved. 40% of people said that their mental health is the same. But about 50% of people total identify that their mental health has deteriorated somewhat or a lot during the pandemic. There's been an increase in mental health concerns in the past year as well. Over 30% of people have noted an increase in the amount of stress or anxiety. Nearly 25% of people have noted an increase in their depression or loneliness. And we care about mental health because, one, we're humans, we should care about it. Two, our voices live within our bodies. And if your mental health is affected, might that affect your voice or how you communicate? Good news though, there've been some positive changes. A lot of people noted that they're paying more attention to their health risk factors. They're valuing the relationships a lot more, and even reevaluating how they spend their time. Even going to the extent of reevaluating life goals. Some people are forging new connections even, and there's a sense of feeling closer to family. And people have actually maintained friendships pretty well during this time. While 72% of people interacted with their friends face-to-face a lot less, and 14% interacted with friends and family somewhat less, 66% of people still said that their friendships had not been affected. And most importantly, people could stay connected even during the stressful time, maybe even more than they had in the past. I know I've talked to people in family and had those Zoom happy hours back at the beginning more than I'd ever had before. So I think we can admit, as much as we may not love it, that social isolation would have been much worse without the webcam and the microphone. And in fact, video chat platforms like Zoom, which we're using now, saw a dramatic increase in use. In December 2019, there were about 10 million users of Zoom. That had increased to 300 million users in April 2020. So we're all experiencing more frequent phone calls with friends and family, virtual friend hangouts and happy hour, virtual weddings even, talking with friends and colleagues, whether for work or for social interaction, online church services, even singing at home from your couch, virtual birthday parties, virtual wedding showers, baby showers, connecting with loved ones that you may not be able to see in person, even virtual voice lessons and virtual voice therapy, like my colleagues and I are doing every day, family game nights, doctor's visits, telemedicine visits, which has really grown in the past year, and talking to patients in the hospital, especially when visitor restrictions were so intense and you couldn't go and see friends and family who were there. The virtual world allowed us to make those connections. And of course, virtual school. By June of last year, about 42% of people noted that they were working from home where they had not been previously. There was actually a recent study that came out with Duke employees specifically, who said that they would prefer to continue to work at home because of some of the associated benefits. No commute, maybe more productive, maybe more flexible, take more breaks, see your dog. But there are associated challenges with working from home and doing life virtually. One of those main challenges said that setting work-life boundaries is really an issue. Despite all that, about 55% of employees nationally would prefer to work remotely at least 3 days a week, based on a national survey. But these work-life balance issues have collapsed that boundary between work at home. If your desk is in your living room, it's hard to step away from work. Remote workers are actually working more, on average working 48 minutes longer, working at night, working through lunch, early in the morning, midnight if you can't sleep. All of that could potentially add up to increased voice demands. And so we've all heard the term probably Zoom fatigue, just the challenges mentally of dealing with talking to people over video, especially with a large group. Well, talking on video calls can also affect your voice potentially. It may cause you to push more with your voice because you're trying to be heard. Maybe you're talking over others. There may be an audio lag or an echo. There may be connectivity issues. We've probably all experienced that. All of that may lead you to have to repeat yourself more. You might be too far away from the microphone, yelling at your computer that's 2 feet away from you. Filling the silence, those awkward times when you're waiting for everyone to join the meeting. You may talk when you might not have otherwise. And just generally overcompensating for how you're communicating with this new, weird, kind of different mode. Even talking on the phone can make our voices feel a little tired. And studies have found that it's actually not the phone itself, it's how we communicate around the phone. So we may use our voices more when talking on the phone. You might talk louder because you perceive that you need to push. You may be talking over noise or talking while distracted, like when driving. The sound may not be great, the reception may be cutting in and out. And if you're talking on the phone, sometimes you can't hear yourself as well, so you end up pushing there too. And then, of course, there's talking through face masks. We can probably all agree that talking through or trying to hear someone through a face mask is pretty challenging. And there have actually been a couple of studies that have looked at this and have shown the face masks don't really interfere too much with articulation or airflow with speaking. But in 65% of people, there was a slight decrease in loudness. Some types of masks, like an N95 or one of those transparent masks, absorb and dampen the sound more than others, like a surgical mask or a cloth mask. So in general, when you're speaking behind a mask, You may overcompensate without even thinking about it, without even knowing, by trying to speak more loudly, speaking more slowly, over articulating. So you perceive that you have to work harder. And by perceiving that you have to work harder, you end up pushing more. When you're talking through a mask and trying to breathe and coordinate your voice and breathing and speaking, it's kind of challenging. So we have the mental fatigue of talking through a mask or over the phone or over video, plus the physical muscle fatigue in the throat from the act of talking and pushing. And that all leads up to a greater potential for voice problems. We're pushing to be heard. We don't have that visual information. The sound is muffled. Our mouths may be dry because we're breathing through our mouths behind a mask. Maybe you're talking through a mask and a face shield like we do here at work a majority of the time when we're seeing people in person. And it's a vicious cycle. It's even harder for people with hearing loss, which is the other side of communication. A lot of people with hearing loss have a harder time hearing through a face mask, and that loss of visual information prevents us from seeing facial expressions and from lip reading. However, good news is, even if you're talking through a mask, being able to see the person talking seems to improve the ability to understand speech. So there's something to that visual information. But with all of this, the mental health changes, the working from home changes, talking through masks, talking over video, talking on the phone, no wonder our voices are tired. No wonder so many of y'all noticed more hoarseness, more vocal strain, more throat irritation in this past year. So now we're going to watch a video talking a little bit more about what patients are experiencing during this time.
Kind of a lot, because I've had to adjust to Zoom calls, Google Meets, outside, inside, but spread out, outside, but really spread out. But again, I have the tools to support that. So we can do some really, really hard things as long as we have the tools to support our voice when it needs it.
The quality of my voice has been impacted positively during the pandemic because I have been able to carve out more time to maintain my individual singing voice. As a result of the pandemic, I was lucky enough to be able to participate in voice therapy via Zoom, which allowed me much more flexibility, particularly since there are no voice specialists in my area. Through my voice therapy experience, I was thankfully able to gain tools that have helped me cope with the new challenges of teaching singing during a pandemic.
Masks are essential to dig ourselves out of this pandemic, right? So in terms of wearing one, I have no problem. In fact, I'm thrilled. Fortunately, I have a microphone that is portable, so I can use my mic. I stick it inside my mask, and that works pretty well for me. And I don't have to do any of the straining that I would have to do if I were teaching in a classroom with two masks on.
Wearing a mask has definitely affected my voice. So I find that when I'm trying to talk to people, I'm trying to not only talk through this muffled lens over my mouth, but also talk with a greater distance between me and the other person because I make sure to maintain 6 feet of distance. And so I find that wearing this mask at times can be challenging to communicate with other people because they can't always hear what I'm saying. They can't see my lips. They can't see the words that I'm trying to say.
Wearing a mask has affected the way I use my voice, but I've been able to use strategies to make vocal production easier when wearing a mask, so that by and large, it doesn't affect the quality of my voice or level of vocal fatigue, but I can still be heard by students. I consistently wear a voice amplifier, which has truly saved my voice this year.
Although we've been socially distanced during the pandemic, my voice has helped me stay connected by FaceTiming other people and really by communicating virtually as I'm doing now.
You know, my regular Zoom calls with my family and my phone calls with my mom and my dad and all of those things are the way that we are able to connect to each other, pandemic or not. Now that I have a voice that can handle it, I am able to, make those phone calls or go and have that backyard glass of wine with someone, and not feel like I need to limit how much I talk to my friends and family.
I'm most looking forward to more meaningful contact with my new granddaughter. She was born just before the pandemic began. My gravelly voice at the time frightened her. She would not get near me, and I have yet to hold her. Well, soon, when she hears my voice, it will be reason for her to yell, "Grandpa!" and run to me with open arms.
I just love people. So I truly look forward to the day that I can gather in a large group of people and just communicate and fellowship with everyone.
I'm most looking forward to simply being in the same room with others and communicating. Though this has been a devastating pandemic, not just for our country, but for the world, I have personally used this as an opportunity to appreciate the wonderful things I have in my life.
I am most looking forward to having an early morning chorus rehearsal with my students. The magic of 64th and 5th graders hearing themselves singing in a room together is the joy of my lifetime. So while there are lots of personal things that I can't wait to do when we are able to get out of this, I cannot wait to sing with my students.
I think I am now unmuted. I'm Audrey Wallstrom, and I would like to talk to you about how to keep the voice healthy. So vocal hygiene, those are the things that we do to keep the voice healthy. That includes taking care of the body in general and using your voice well. One of the easiest things that you can do to take care of your voice is to drink plenty of water. The better hydrated you are, the more efficiently your vocal folds vibrate. Well-hydrated vocal folds are less likely to be hurt from using your voice. And we advise most people to drink about 64 ounces of water per day. Some things that contribute to vocal fold dryness: drinking too much caffeine and alcohol, being in a dry environment, especially in the winter when the heat is running, for example, and certain medications can have drying effects on the voice. When I look at the picture of these vocal folds right here, I know this person is not well hydrated because I can see thick, sticky mucus. So we would tell that person to drink more water. Many medications can have a drying effect on the mucous membranes, and that includes a lot of your over-the-counter cold and allergy medicines. Here's a resource for you from the National Center for Voice and Speech if you'd like to check on some specific medications. But of course, you should always ask your doctor before you make any medication changes. We want to stay healthy in general to keep our voices healthy. So that means maximizing your resistance to illness. We have all been thinking about that much more than we would have liked over the last year. So we want to minimize the risk of infection through some basic public health measures, and also eat well and sleep well. Lozenges can be soothing for the voice, but we want to avoid those with menthol, mint, or eucalyptus. So here are some suggestions for some products that do not have those drying things as their active ingredients. So instead look for glycerin, slippery elm, or pectin as an active ingredient. We also want to avoid unnecessary trauma to the vocal cords in the forms of coughing harshly or throat clearing. So if you feel a tickle in your throat, try swallowing like I just did, taking a sip of water, or taking some deep breaths and wait for that tickle to subside. Also, if you are sick and your vocal cords are swollen, you want to avoid talking or singing, as that is a time to rest your voice. Remember that your vocal fold edges come into contact with every cycle of vibration for hundreds or for hundreds of times per second. So if you have easy, gentle contact, that will lead to vocal resilience, whereas hard, forceful contact, that makes you more predisposed to vocal fold injury. Learning to use your speaking voice well. We'll have more about this a bit later tonight, but as an overview, optimize your posture. You want to use good breath support, a frontal placement of the tone, and we want to minimize muscle tension and strain. Common misconception that a good speaking voice means talking higher. That is not usually true. We want you to speak at a pitch that is natural for you, but that is well supported and energized. Some of these things over time can lead to a voice problem. Throat clearing and coughing, yelling and screaming, talking too loudly, talking in noisy situations, and sometimes singing without adequate technique or training. Remember, it is not normal to be hoarse after voice use. So if you are experiencing that, we want to eliminate any possibility of voice injury. Pushing through that can result in permanent damage. So we want to get on top of that and figure out what's going on there. Vocal pacing, that is the concept of how much you're using your voice, how intensely, meaning how loud, and in what situations. Optimized vocal pacing is going to include both avoiding excessive, inefficient, or injurious voice use, so not overdoing it, as well as maintaining strength and conditioning through regular practice, so not underdoing it either. If you can think of the hours in the day like a vocal clock, how much you use your voice may contribute to a voice problem. So make sure to give yourself voice breaks and make time to rest your voice. Prioritize your vocal demands. So think about what's the most important thing you need to do with your voice that day. And if there's anything you can cut out that's not essential, think about doing that. So maybe after a long day of meetings at work and your voice is tired, that's not the time to sing along to the radio in the car on the way home. So if you can schedule breaks during the workday, that's great. If you can schedule your work week so that you alternate between heavy voice use days and lighter voice use days. Let's also think about talking in loud environments. So straining your voice to speak over background noise is just wasted vocal effort. So consider minimizing that background noise. Amplification is something that is very helpful for a lot of our patients, especially our classroom teachers, public speakers, but really anybody who presents to a group. I have never had anyone say that they regretted looking into amplification, and there are a lot of different options and price points. So think about that if it might make sense for you. If your voice takes an evening, a weekend, a holiday break, or maybe even a summer, if you're a teacher, to recover, then that might be a red flag. If you have a change in your voice quality that lasts for more than 2 weeks, if it's hoarse, raspy, breathy, or gravelly, you can't make your voice as loud, your range has changed, you're noticing voice breaks, it's more effortful, or you have less stamina, we want to find out why that is. So remember that your voice needs time to rest and recover in order to avoid a more chronic voice problem. We are here to help if you are experiencing any of these things. Specifically in the pandemic, as Lauren discussed, we've had a lot of challenges vocally. One of them, wearing a mask. So some solutions. It's going to work better if you have a well-fitting mask with adjustable ear loops and a wire that contours to your nose, so that you are not trying to anchor the mask with facial tension because your mask is slipping around. Be particularly mindful of hydration. So when you do have a chance to have the mask off and drink, go ahead and do that. And if someone can't hear you, consider rephrasing and using more inflection or hand gestures instead of just saying the same thing louder. That gives your listener more information. Another challenge, a lot of the healthy vocal activities like choir rehearsals are not taking place as they usually would, and we are losing some of our vocal conditioning. So what can we do about that? Well, make your own vocal practice routine at home. So when you sing on your own at home, you can make it a ritual and make the time and space to do that thing that you love. No reason not to sing along at home to your favorite recordings. If you have sheet music and if you're in a choir and a recording of something that you're familiar with, go ahead and sing your parts. If you're not a singer, consider reading aloud or talking to your pets. I'm sure they would like that. Another challenge, talking into a computer screen like I am right now, it really encourages us to overdo it, to try to close that distance. So for video conferencing, consider investing in an external microphone like the one that we are using tonight, using headphones or earbuds so that your conversation partner sounds like they are close to you. That tells us we don't have to speak so loudly, or a headset. Visual cues can help you remember not to overtax your voice. So muting yourself, so you're intentional about when and how much you speak. Putting a Post-it note on your computer or next to your computer, alarms or reminders on your phone, or even blocking it into your digital calendar just as a reminder not to use your voice when you don't need to. We want to think about optimizing vocal efficiency. So do a quick vocal warm-up even before online meetings or phone calls. In between, take a break. Go ahead and stretch your body and rest your voice. You can optimize the acoustics by facing a corner or a wall so that the sound of your voice bounces back to you. And if you are wearing noise canceling headphones or snugly fitting earbuds, you can try taking one side out so that you can hear your voice in the room and you're not trying to speak too loudly because your own voice is muffled. Also plan the ergonomics of your setup so you can sit comfortably and have optimized posture for voice. So we just spoke a lot about finding opportunities to rest your voice. It is also true that some of us are not using our voices enough, maybe especially in the last year. And this can be particularly true for older adults. There is a use it or lose it aspect to the voice. So try to find ways to stay connected and keep your voice active. Now let's hear from our patients again about how they were able to keep their voices essential.
I would have to say the warm ups and being purposeful about warming my voice up prior to a short or long day of vocal use. Because as a voice student, I warmed up prior to a voice lesson and in my voice lesson, of course, and then prior to major performances. But outside of that, I never really focused on warming my voice up before minor speaking engagements or before a full day of classes. That has made all of the difference when it comes to being able to speak for a longer amount of time and being able to sing all day and wake up and still have a voice.
I've been vigilant about wearing my personal voice amplifier during instruction and in general communication at school, and finding appropriate resonance for speaking as well as singing.
Hydration is one that I really noticed when I started getting better about it. It makes such a gigantic difference. Also, I think awareness is what I found voice therapy to be the most helpful for. Videoing myself teaching, being aware of where I am in terms of my range. I know for myself, when I get excited, I talk really fast and I also tend to talk really loud. And because I know that about myself, I can adjust. The other thing that I found really important is digging out that time to warm up absolutely every day. Warming up for me is a non-negotiable. Sometimes it's abbreviated, sometimes it's like on the way to work. It's not always a beautiful, I sit down at the piano and I warm up my voice, but if I miss it, I will feel it at the end of the day.
Get the advice of a professional. What to expect, solid advice about how to proceed, and strong encouragement.
Needing surgery to repair a vocal issue is not a personal failing. You deserve to have a healthy voice that you're able to use the way that you want to use it. I teach pre-K through 5th grade. I teach 6 classes a day. I have a chorus of 60 students. What I do vocally is a tour de force. No one yells at athletes for having injuries because they use their bodies and then need medical help to put them back together when they use them in an intense way. So if you are using your voice and you become injured, you need to go get help. And that help exists and they will make you feel so much better.
How to rest, how to speak properly, and I've learned how to love my voice in every single state and stage that it's in. It was very hard for me whenever I wake up with no voice and I'd want to sing a song, but I couldn't hit that note that I knew I used to be able to hit. But ultimately, in this time of healing and in this time of resting, I was able to reflect on the things that I've already been able to do with my voice and remain hopeful and remain steadfast in knowing that with proper rest and with proper time and with proper amounts of water and just being patient, my voice will recover and that we will overcome. And I think this is a message that I not only was able to translate via my vocal recovery journey, but through my journey through life, that sometimes it's okay to take a break and to rest.
I think I've learned a lot about my voice and about myself. But I think that the connections that we make to other people are things that we don't take for granted anymore because we haven't been able to necessarily hug our loved ones or get on a plane and go visit someone or even just go out for dinner with a friend. So every interaction that I have outside of my household bubble, I take very seriously. I am grateful to have a healthy voice that lets me enjoy those times without fear of not being able to do what I love to do for a living.
I have learned how to prioritize the important things in my life, one of them being my voice. I have the wherewithal to seek out expert research and advice and to make decisions that are best for me. I feel confident in advocating for things that affect my health and the health of others. Get help now. Doing so will arm you with tools to take charge of your own vocal destiny. These experts will support you along your journey, and it will get better.
My voice feels better now than at any time since the initial paralysis.
Making these changes has truly been the best thing ever.
Thank you to Dr. Cohen, Tara Nixon, and everyone else who helped me on my journey back to having a great voice.
Thank you so much to the team at Duke for helping me navigate what could have been an exceptionally difficult time.
And to my audience today, I say good luck to each of you on your own voice journeys. And thank you for letting me share my story.
Oh, goodness. And thank you so much again to those 3 patients who provided their stories and helped us see that voice care is for everyone. Our voices matter. We have changed how we've used our voices recently, and you don't have to stay stuck. In my opinion, as a speech pathologist and voice therapist, it's helpful when patients understand a little bit about how the voice works to know how to take care of it, how to improve it. So we're going to briefly talk about how your instrument functions. The voice is essentially a system with 3 main parts: the breath, the vibration, and the resonance. So in order to speak, you take in a breath, your lungs expand, and then you exhale. You use your stomach muscles to breathe out. That breath comes up from your lungs and vibrates the vocal folds. The vocal folds themselves create a sound. That sound moves up from your vocal folds into the space above them, the upper part of your throat and your mouth. That sound gets shaped by your articulators, your lips and your teeth and your jaw, and that sound starts to sound like you, sounds like speech. The sound is created in the larynx, otherwise known as the voice box. Your larynx sits on top of your windpipe or your trachea, and it has to do several things. It's responsible for sound production, breathing, and protecting your airway. The larynx sits in your throat, right around there, and you can feel your Adam's apple. If you place your fingers flat on the front of your neck and swallow, you'll feel it bob up and down. The larynx has a couple of main structures to it. At the top is the hyoid bone, which is a very cool bone that is attached to a whole bunch of different muscles. Beneath the bone is the thyroid notch, or in other words, your Adam's apple. That's what you feel in the front. And your vocal folds live inside that cartilage. And then below the larynx is your windpipe or trachea where you breathe. Looking at the throat from the inside, we're looking from a bird's eye view here. So down at the bottom of the screen would be the front of your neck. And the top of the screen would be the back of your throat. And then it's flipped. So the right side of the screen is the left side of your throat, and the right side of your throat is on the left side of the screen. We can see your epiglottis, which is some cartilage. We can see the opening to your esophagus where food and liquid goes when you swallow. We can see your windpipe or trachea, and we can see the two vocal folds right there in the middle. You'll hear us say interchangeably vocal folds and vocal cords. Vocal folds is technically more correct, but vocal cords is what's most commonly known. Just know that it's not vocal cords with a CH. Here's a view of the vocal folds open. They open wide when you breathe in and out to let air pass through. So think of it as a door that is open. When you speak, the vocal folds close and they begin to vibrate. So you breathe in, and then as you say sound, e or ooh, the vocal folds vibrate and oscillate evenly. The vocal folds vibrate because of air pressure. Air pressure blows your vocal cords apart and then sucks them back together, and they vibrate very, very quickly, like 100 to 200 times a second for most speakers. You can see from the side here how it works. The air comes up beneath them, blows them apart, and then sucks them back together. When you go up in pitch, like ee, the vocal folds stretch, like when you stretch a rubber band and then pluck it. When you go down in pitch, ee, the vocal folds shorten and they become a little bit more lax, like a rubber band, when you decrease that stretch. The vocal folds vibration is powered by breathing. And a lot of you have probably heard you should breathe from the diaphragm or sing from the diaphragm. Well, what does that mean? The diaphragm is actually your main muscle of breathing in. It's a dome-shaped muscle that sits underneath your lungs, and it moves down to help you breathe in, and then it relaxes to help you breathe out. Along with breathe from the diaphragm, you've probably also heard I should breathe into my belly, or my belly should go out when I breathe in. And this is true. We don't want breathing to occur high up in the chest. We do want breathing to feel like it happens down in the belly. Now, breath is still going into your lungs. You're not breathing actually into your abdomen, but when you breathe in, your diaphragm contracts and pulls down. As it does that, it creates space for your lungs to expand. Your lungs have negative pressure. Air from outside your body wants to come in and fill up your lungs with air. In order for your diaphragm to contract and pull down, it's got to push your guts and your organs out of the way. So that's why you'll notice that the belly moves outward as you breathe in and fill up with air. And as you breathe out, the opposite happens. The diaphragm actually relaxes, the belly muscles get tighter, and they propel air out of your lungs, which gets smaller as they empty. So we have breath, which goes up between the vocal folds. The vocal folds vibrate. And then we have this idea of resonance. So essentially the sound from the vocal folds bounces around in your mouth, your nose, the bones of your face, and it gets magnified and more powerful. Just like the sound in a chapel, like this picture of the Duke Chapel, for example, bounces around and gets magnified. Or like the sound does when you're taking a shower. That's why we sound so good, because the sound is bouncing around. That's what happens when we speak. And this change in resonance, or how you move your articulators, is what makes you sound like you, and what makes me sound like me, in part, and what makes ah sound like ah instead of e. So when we put it all together, we have your resonating system, where that sound is bouncing around in your head, in your mouth, in your face. We have the vibration of the vocal folds providing the source sound. And we have your power source, your fuel system, which is your breath. When you put all that together, that's how you get speech or singing. So now that you have a bit of an understanding of how the voice works, let's go into what to do about it. We've talked about this time has been tough on our voices. Here's how the voice works. Here's how you can take care of your voice. But what should you actually do as part of a voice warm-up? We're going to start now with some stretches. If your job was to run all day, every day, or to jump rope all day, every day, and you didn't stretch or warm up your body, you would be pretty uncomfortable. You'd be prone to injury, and you would get very tired. Your muscles and joints would not work optimally. Your voice is a bunch of muscles, and it's a very coordinated, highly finely tuned system that needs stretching and relaxation and a good warm up for it to work efficiently. If your body is tense, it's harder for your voice to work easily. So first, we're going to think about muscles in the neck. If you look at this picture here, you can see that the Adam's apple, the larynx, is right inside, tucked underneath all these muscles. So when you look at it, your neck is just a whole bunch of muscles keeping your head connected to your body. And these muscles can all get tight. They're like those finger puzzles as a kid. The harder you pull, the tighter everything gets. So one thing I like to start with a voice warm-up is some shoulder rolls. Rolling your shoulders backward, and y'all can do this with me, even though I can't see you. Rolling your shoulders backward a few times. And then rolling your head from shoulder to shoulder. We're not going back, just in the front, nice and slow. And of course, if you have any neck limitations that prevent you from doing this, you can skip this portion. Gently rolling from side to side. And then you're going to bring your head back to the middle, still looking down. Roll your shoulders back once more and bring your head back up. With your head position, we want to make sure that you don't have tech neck or turtleneck, where your head is jutting forward. We want to keep the back of the neck elongated as if there's a string connecting you to the ceiling. Not in a tense way, but in a way that you're not slumping forward. So keeping that neck relaxed, shoulders rolled back, we're going to do a shoulder shrug. You're going to breathe in through your nose as you bring your shoulders up to your ears. And then breathe out as you drop them. Now, I just said don't breathe up in your chest and shoulders. That's true. But for this exercise, we're consciously creating tension so you can recognize it when it occurs, and then consciously releasing it with the breath. We'll try that twice more. And drop those shoulders real fast so they reset. You don't want to keep them tight. You want to fully let that tension go. All right. Then we're going to do a couple of neck stretches. You're going to place your hand flat on your sternum and anchor with your hand and tilt your chin up. And breathe while you look for a stretch through the front of the neck. With your hand in the same position, you're going to gently lean your head away from your fingertips and feel a stretch now on the side of the neck. And breathe through the stretch. Switch hands and lean away from your fingertips. Each of these stretches you would do ideally for 1 to 2 minutes each. We're doing them a little bit more briefly this evening just for the sake of time. Now we're going to move on to some muscles in the face. A simple stretch you can do is the Home Alone stretch. Place your hands flat on the sides of your face, press in a little bit, and pull downward. We're looking for a stretch here on the side of the face in your big jaw muscle. Keep your jaw and tongue relaxed and just breathe. And again, hold the stretch for about 1 to 2 minutes. You can then transition to the fishy face stretch, where you're bringing your hands now forward, perpendicular to the way you were just stretching. And now you're looking for a stretch from behind your ear, through the jaw, and coming forward. Don't fight it with your jaw. Don't keep your jaw closed. Just let everything release. We'll pretend like that was a full 2 minutes for that stretch. And we'll move on to a tongue stretch. The tongue is a very large, strong muscle in your body. The part that you see in your mouth is actually only a small piece of it. The tongue actually goes down and connects to your larynx. So it's intimately involved in creating speech and sound. One easy stretch is to just let your tongue hang out. And breathe while you stretch. If you want to, you can also hold on to your tongue with a towel or a cloth and pull your tongue out, or stretch it to each side. Stretch, breathe, and hold that stretch for approximately a minute per stretch. So now that we're feeling relaxed, we're thinking about good posture, I'm going to bring my colleague Audrey back to talk about the next part of our voice warm-up.
Okay, now let's do some exercises that involve making sound. So let's talk about something called the semi-occluded vocal tract. That is a fancy way of saying that a small opening at the front of the vocal tract, meaning the mouth, helps create back pressure on the top side of the vocal folds, which combined with air pressure coming from below, helps the vocal folds close with less muscular effort and collide with less force. So it's really easy and gentle on the voice. So it feels open on the inside, almost like a yawn feeling, like a reverse megaphone, as you see in the picture here. Some examples of sounds in this family: a lip buzz or a lip trill, a tongue trill, humming, this thing called a bilabial fricative, which is a fancy way of saying, I just make a very small opening with my mouth, almost like an O that is buzzing in your lips, and using a straw. So blowing into a long tube does the same thing. Let's talk a little bit more about straws. So the resistance, that back pressure, is increased when you blow into a long tube, which makes your vocal tract longer. So we can use this to find a nice, clear vocal sound. You may not have a straw with you right now, but you can go ahead and do this later if you want to watch this at another time. So what we're trying to do is make this entire tube resonate and vibrate. So we're going for a clear sound. What we don't want is this. Do you hear that hissing? If you hear that hissing, that means there is too much air coming through. You can also do any kind of vocal warm-ups or pitch glides that you're used to doing. We can take this even further by adding resistance in the form of water. Here we go. So if you've ever seen folks doing physical therapy in a pool, this is a similar concept. They're using the resistance of the water in order to build strength, but it is low impact. That is a good thing for the voice. The diameter of the straw and the depth of the submersion, that will change the amount of resistance. So a larger diameter straw and shallower water, that's going to be less resistance. And a smaller diameter straw, like a coffee straw, and deep water makes more resistance. For most people, about an inch or so under the water with a normal drinking straw is going to do just fine. So we can do some exercises using the straw and water, like a stretch up. So let's Glide steadily from the bottom of your pitch range to the top and trying to keep your throat relaxed. So that might sound something like this. So I went like this. Whoop. I started at the bottom and went to the top. We can contract the vocal cords by going the other direction. So we start high and go low. So I went, started high and went low. I mentioned this term forward placement earlier. So that refers to sound production that feels as if it is vibrating in the front of the face. And this is going to depend on good, consistent airflow and an absence of strain or effort in the throat. So when this is happening well, you may notice vibrations around the nose, upper lips, teeth, tongue, or the roof of your mouth. And that indicates good resonance, as Lauren discussed, in the oral and nasal passages. A great way to feel this is with a hum. So let's try that. Go ahead and take a deep breath. When I do that, I feel vibrations in the front of my face, and it feels easy and effortless in my throat. If you're humming like this, that is not going to work so well. A few things to get this to work. You can say with an H. You can say the word hum, hum. Pretend you're agreeing with someone, or a hum sigh, so a with lots of breath flow. Now let's hear from Caroline again, and we'll see how we can apply some of these concepts to your speaking voice.
Hi, I'm Caroline Banka, back again to lead everyone through some very simple voice exercise targeting the speaking voice. We'll start with some voice exercises targeting the breath. The breath is essential. A steady release of breath as we speak is essential to an energized, clear voice. I'll be showing you some simple strategies to get the breath flowing for speaking. We'll be using an arm gesture to get the breath flowing. We'll do some chanting to establish a really free-flowing breath that we'll apply to speaking. It's really important to follow through with the breath rather than just let it trail off. The voice and the breath are married, and the voice and the breath need to have a sense of direction, of momentum, of forward motion. So as I'm saying a phrase, I'm going to do an outward kind of arcing arm motion like this. How are you? Thanks so much. So the arm gesture is moving outward. Here's the first one. More cream. Your turn. Next one. My name. Your turn. My home. Your turn. Okay, now we'll do some that are a little bit longer. Notice that there are a lot of M's in these phrases. So see if you can feel some vibration on those M's at the beginning of the phrase and at the end of the phrase. You might feel the vibration on your lips, your nose, teeth. My mom is at home. Use the arm gesture. Your turn. Great. Math is my main problem. Use the arm gesture. Your turn. I'm meeting with the team. Your turn. Great. Okay, here's another really simple, effective technique to get the breath flowing efficiently when we speak. We're going to chant the phrase to establish this really free-flowing breath. We're going to apply that to when we say the phrase. So I'll demonstrate the first one. My home is on a farm. Now I'll say the phrase. My home is on a farm. I used the same kind of breath for chanting and speaking. Okay, you try it, chant it, then say it. Great. Okay, one more. I'm going to the gym. I'm going to the gym. You try it, chant it, then say it. Okay, great. Now we're going to talk about pitch a little bit. Pitch is not just for singers. For the speaking voice, pitch variation is essential to effective communication. Pitch variation or inflection, the melody of the speech, it's the expressiveness of the speech. So when we say, how are you? We want to use an up and down when we're talking. Thanks for coming. Again, we're using inflection expression, not thanks for coming. How are you? In our language, we use a downward pitch inflection to indicate that we've come to the end of a thought. Most of the things we say end in a downward pitch. One of the problems is that we often swallow the last sound. That's a problem because the last sound in the sentence is just as important as the first sound. So the tip for you to make that last sound just as clear as the first sound is don't go down in pitch too early. Wait until the end, near the end of the phrase, and go up just before you go down, just like the outline on the screen there. Let's practice. Okay, on top, it demonstrates the swallowing the end way. Maybe I'll go home. So we don't want to do that. Let's try the one on the bottom. I'll demonstrate. Maybe I'll go home. Notice that the downward pitch glide comes only at the end. I'll do it again. Maybe I'll go home. You try it. Great. One more. I don't want to say, thanks for your time. Instead, let's try, thanks for your time. You try it. Great. And now I'll end by saying with feeling, thank you so much for your time.
So in the past hour and a half or so this evening, we've learned that voice challenges are really only part of the changes we've had to deal with for the last year, and that our voices are not islands. They live within our bodies. They work with us. They matter to us. They're essential, whether you use your voice to sing or to speak or to read to your grandkids or to work or whatever you need to do with this precious instrument. And although we may be going back to normal or our new normal soon, and some of these issues will be moot, we know that vocal health is an important aspect of quality of life and communication, no matter what's going on in the world. We know that many people are going to be working from home for long term. We know that technology, like talking over Zoom and having video calls, is probably going to be a new part of our lives from now and forevermore. We're going to need to have awareness of our voices, understand that they're essential, and have tools to keep our voices essential and healthy. So thank you all for attending tonight. I wish we could see your faces. It's different than seeing everyone in person, that's for sure. But thank you for riding along with us for this webinar offering. One other thing I would like to say is if you are having a problem with your voice or your throat, as many of you mentioned, we can help. That's actually what we're here for. We are here to look at your voice, help you take care of your voice, teach you how to use your voice effectively. So in order to meet with us, you can go to www.dukevoicecare.org, or you can call the number on the screen, 919-684-3834, and we can help you out. We would love to help you take care of your voice. You can also follow us on social media, Instagram or Twitter at Duke Voice Care. As part of tonight's presentation, we have a digital handout for you on tips for keeping your voice healthy while socially distanced, talking about your setup, voice breaks, reducing background noise, using headphones, an amplifier, getting creative with how you use your voice. On that handout are also some links to previous webinars we've presented on singing voice health during COVID-19 and beyond, and a session 2 for singing voice health, including question and answer sessions. We have a future offering coming up in September of this year, the specific date to be determined. It's a 90-minute webinar for older adults, sponsored by the Orange County Department of Aging, talking about how the voice changes over time, the importance of our social connections, vocal hygiene, and voice exercises specifically for keeping voices strong. On Friday, 2 days from now, you will receive an email with information on accessing the recording of this webinar on demand on YouTube, and a short 5-minute survey about the event itself. We really want to hear your feedback. This is the first time we've done a virtual World Voice Day, and we want to know how it went. When you take this survey, you will get a link to the on-demand webinar recording. You'll receive a copy of our digital handout, and you'll be entered in our prize drawing. We are going to draw 2 winners who are going to win something related to vocal health. For questions or to learn about future events, please email karen.stark@duke.edu. She is our Duke Voice Care Center liaison and will direct your questions appropriately. Thank you so much for coming. We truly appreciate you, and we hope that you take care of that essential voice. Have a good evening.